The educational talks we give to our patients over and over, day after day. We're going to speak with a doctor who wants to put it on video and let your patients tune in. You're listening to ReachMD XM157, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm Dr. Michael Greenberg, your host, and with us today is Dr. Dean Heller, president of VideoMD.com. Welcome, Dean.
Hi, how are you today?
Oh, great. Listen, Dean, tell us first about yourself and about your career in cardiology.
Well, I am a practicing interventional cardiologist. I've been practicing in Miami for about 10 years. I grew up in New York, New Jersey area and trained in the Northeast. And I've had a busy interventional practice for the past 10 years in Miami.
All right. So what got you inspired or involved in VideoMD? Tell us your story.
Well, basically, I'm one of a number of people that are involved in VideoMD, but how I originally got interested in it was I would do some of these health fairs. I would do the hospital-sponsored health fairs and any number of talks throughout the year. And when I would go to the health fairs, I would invariably look at the audience and see 20 or 30 of my own patients. So certainly I would, go talk to them afterward, and I'd ask them why were they there, and they could see me in the office, essentially. Invariably, they told me that I didn't do nearly enough education in the office, and they were there to hear some basic good health information. And, our lives are busy, our day-to-day, your schedule's busy. I go in for acute MIs and CATs all the time. And day-to-day, it's very difficult to individually educate patients. And that's how this sort of came about.
Well, I like the idea of videotaping things because sometimes when you say something over and over again, too, it starts to get a little stale. So how does VideoMD work?
Well, VideoMD is essentially a YouTube for physicians for patient education. So a doctor will upload videos. They can make videos essentially with their own video camera. They don't have to be expertly produced, although if people want it, we can add slides to the videos. And then the site is fully uploadable, so the doctor uploads videos. The videos are then viewable in the physician's own page of VideoMD. So then he or her will direct their patients to VideoMD, and then the patients search by the doctor's name. And then all the physician's videos will be on one page for the patients to be educated by their own doctor.
So we don't charge patients to come on there, correct?
No, it's all free. Physicians upload videos for free, and the patients can view videos for free.
The whole system's free?
The system is entirely free to use. We will eventually have some advertising. We don't currently, but eventually we will have some advertising, some banners to help sustain the website. We vowed, and if you look in our About Us statement, we are not going to make the amount of advertising burdensome. We're going to make sure it's limited. We're going to try and make it as relevant as possible. But that's how the site will sustain itself and make it continually free for everybody to use.
Wow. So why can't doctors just create their own web pages with their own videos? I mean, the technology isn't that complex, is it?
No, certainly they could do it. And we certainly, if doctors make videos, we think that they should be available as many places as possible. So certainly there are doctors that have videos on their own websites, and we have contacted a number of those doctors and asked them to put their videos also on VideoMD. And we like to think of VideoMD as really a place for all the patients to be educated. And I think patients will see that if their doctor's involved with a site that has patient education as its mission, that it'll overall improve the collective physician-patient relationship.
Well, this sounds pretty altruistic. How many people are involved in the project itself? Not the people whose videos are there, but people like you.
We have, there's certainly a good number of people that are involved. Many of us are all part-time, a lot of practicing physicians that went into the development of it to make it as user-friendly for physicians and for patients. And then we have certainly some business people involved, some advertising people. And then we actually help some local physicians, and we're trying to hope that we can help many physicians film some of the video. So we have some people that are helping out part-time with filming. So we have a large group of people, probably 20, 25 people that are involved. The overwhelming majority are doing it part-time.
Are you guys underwriting at the present time financially?
Yeah, we have a number of physicians essentially that love the idea, and a lot of people that we've talked to so far really love the idea of it. So between a number of the original doctors that were involved and some other people, we basically have self-funded so far. So it's been very successful in the short term. And, obviously at some point we're going to, like I said, open up for some advertising to help sustain it and help it grow.
Okay, if you've just joined us, you're listening to ReachMD XM157, the channel for medical professionals. I'm Dr. Michael Greenberg, and I'm speaking with Dr. Dean Heller of VideoMD.com, a web-based company that wants you to use your videos to educate your patients, and they want to do it for free right now. Do you have any videos on there personally?
I filmed about 10. One of my passions is cooking. So I am involved actually with a local chef, and we've done a lot of demonstrations, heart-healthy demonstrations. So actually I filmed a Emerald-style cooking show where we did about 10 recipes because I get asked every day, from all my patients what to eat and what's the best things to eat. And I thought the best way to educate them was to show them the best way to cook.
I think that's great. How many doctors do you have participating? How many are making videos for you?
We've been up for about 2 months, and with some limited advertising so far, we already have about 200 doctors that have signed up, and quite a good percentage of those have already uploaded videos. So we have, I think, about 250, 300 videos already on VideoMD.
Okay, now when you say advertising going on there, is the advertising going to pop on in front of a doctor's video, or is it going to be on the website in general?
The website, when I say we've done advertising, we have been advertising a little bit to doctors to try and just make them aware of it. We've advertised in a few of the journals, in JAMA, and online a little bit.
Well, that's how we heard about you. We got an email blast.
Right. Yeah, so we advertised the email blast from MD Net Guide. And so we're just trying to get the word out there.
Okay, well, we're going to help you, but I have a couple of questions because I like this concept. When you do put advertising on your site, if I put my video on about teaching my patients about acne care, are they going to have to watch an ad for Viagra before they see my video for acne care, or is the advertising going to be off to the side somewhere?
Most of the advertising will be banners. We do not have any video advertising currently, although that has been thrown around a little bit, and we've just trying to decide, find out eventually how much advertising we'll need to sustain the site. There may be some short videos, but we, again, in our About Us statement on the website, something where really do not want to make it too burdensome, the amount of advertising. So if there are some videos, it's going to be very limited. It will not be before every video, so it'll be every 10 videos. So we want to really make it as limited as possible to not make it burdensome for the patients, because frankly, that annoys me when I see too many advertisements.
Right. Now, do you go over the individual videos for content and make sure that there's nothing in there that's bad or wrong or things that you don't want on there?
The website is available for all doctors. So basically, the website is kind of designed in a way that all physicians can upload videos, and they're all available on their own individual pages of VideoMD. So those videos we don't necessarily review for content, in that obviously doctors can tell their patients what they want to tell them. However, of the videos, of any video that is good content, that looks pretty good, we put those videos on the featured videos section, which is searchable by disease, searchable by category. So all of those videos are all reviewed for medical content from a specialist in that given area.
Okay, so you don't turn down any videos at all.
We do not turn down videos. They will all be searchable by the doctor's name. The videos that we think may not be necessarily up to par will just be on that doctor's physician profile and would not be searchable by disease and by category and those other searchable factors.
Is this open to just MDs, or can chiropractors go on there, dentists?
We really are available for anyone to use that is a healthcare practitioner. So we have a section actually for your teeth, so we want to have dentists, chiropractors we would be available for certainly, and any other healthcare professionals. We actually, in the section which is going to have my cooking videos, is called the Cardiologist Cookbook. So in that, we've actually filmed a number of nutritionists giving some basic nutritional facts, and they've done a fantastic job, and those are available on there currently.
Do you find doctors have trouble or difficulty doing these videos? I mean, sitting in front of a camera, do they stutter or have problems?
Yeah, listen, I think we're all educators, and I think we all educate our own patients, but it's not easy. We're not trained to be in front of the camera, and it's not easy for doctors. But again, we tell people you're essentially talking to your own patients. So whatever you tell people every day, those are the important ones. And if they're not great and you don't want them searched by disease and by the rest of the people that are searching on the website, the doctor can actually tell us to not put it on the feature part of the website. So the doctor chooses if he wants it just on his profile or if he wants us to review it for the other part of the website.
Do you have a way of tracking patients who listen to these videos?
There are ways to do that, certainly. We haven't implemented them just because we're always concerned. There was a lot of discussion about patient confidentiality and things like that. So we have not implemented that.
What I was thinking was just the opposite. For instance, I have patients as a dermatologist with Accutane, and I give them the booklet, the official Accutane booklet, and I mark in my chart the patient received the booklet. If we know that a patient watched a certain video, that would be part of an informed consent process. This could be very valuable to a doctor later on.
There's a way to do that on the website, and we specifically tried to veer away from clear-cut patient care, where you were clearly having a patient care mechanism on there, although certainly it's available. I think it's a great way to use the website is video consents, and certainly you can have people learn about procedures on there. There's a way to do it. Certainly the patients can make comments on videos, and physicians can reply to patients on the website. So you can actually ask people to just sign their name on there or put their name on there on an individual video, and then the doctor can reply on that video. There's a function for that, on the website for anybody to make comments. So there is a way to do it. It's just there's no clear mechanism for it.
Okay, so if I get on there and do my videos, people can respond and say, wow, you should remain on radio with your face?
That is true. They could say you have a radio face. And so basically all the videos can be commented on, and then the doctors have the availability to reply to the videos. We wanted to let people know, and we put it in the help section, that it's not mandatory for physicians to reply, that this is purely educational, but certainly they have the availability to do that.
I see lots of possibilities here that could be very important. How do listeners who are interested get in touch with you?
Basically, they just go right on the website, VideoMD.com, and there's a way for them to contact us through email there. There's also a telephone number on the website if there's any questions. And we're available for help anytime.
I think that's great. And you'll help them with their videos and help them download. And those of us who look at computers and wince, you'll help us with all of that.
Yes, definitely. And we actually, on there, we also tell people that if people do videos and they have any trouble and they're not sure how to do it, they can actually just send us the videos in the mail and we will upload them for them.
Awesome. So if you had a wish list, what would your vision for the future be? Paint me a picture of VideoMD.com 10 years down the road.
Well, I think you sort of alluded to it. I think that these technologies it's something that's clearly, the future is here, and I think doctors have to use current technology to help the physician-patient relationship and help themselves by improving their day, by trying to streamline education and any other processes. So eventually, we would like to see VideoMD obviously used by a large number of doctors. We think it's a great tool for people to use. But I think in the future, you could also see interactive processes on VideoMD where there's video conferencing, where doctors can conference with their own patients.
Dean, I think this is a fabulous idea, and thank you for sharing it with us. And we hope that it grows, and we can hope maybe check in the future with you and see how you've done. So thanks for being our guest today and telling us about VideoMD.com. I'm Dr. Michael Greenberg, and you have been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. ReachMD XM is here for you, the health professionals who care for your patients. We welcome your questions and comments. Please visit us at ReachMD.com. Our new on-demand and podcast features will allow you to access our entire program library, including this show. Register on the website and enter promo code RADIO for 6 months of free podcasts. And we thank you for listening.